Dr. Rosie Hogg, thank you so much for joining me for this quick 5-minute interview about REUK 21. How are you?
I am great, Amit, and it's fantastic to see you. And I'm just thrilled to be chatting about REUK again.
Absolutely. Well, listen, the first thing I wanted to ask you is why are you looking forward to REUK 21?
Well, like everybody else, we're just exhausted after a terrible year. Everybody's, worked themselves really hard to the bone, and we were so disappointed not to be able to do REUK last year. As everybody knows, we hosted REUK in Belfast in 2019, and it was a fantastic meeting, and everything we've got planned for REUK 21 is just going to be even bigger.
I can't say I'm really excited myself, but tell me, why do you think people should register for our meeting this year?
Okay, so the great thing about REUK is it's such an inclusive meeting. So regional has really come into its own in the last year. All of us who, are classed as experts or people who love to do regional, we were using it all the time anyway. But the COVID pandemic has really brought regional to the fore, and everybody's been doing it using short-acting spinals and trying to do patients under block. So it's great to be able to have a meeting that brings all that together for people who've maybe been doing a little bit of regional, right up to those who are experts and really want to learn a little bit more. But for me, it's all about the point of care ultrasound. As everybody knows, I talk endlessly about it, but we've got the most fantastic POCUS symposium planned for you all. So it's experts from all across the world. We've got Johnny Wilkinson, we've got Kareem El-Baghdadi, we've got Chris Yap from Sheffield, where REUK 21 is going to be. And unfortunately, we can't bring him in, but we've got Stephen Haskins coming in via video link from the US. So we're just thrilled to have such a great faculty. And we're really just moving it forward a little bit. Everybody is sick of looking at Zoom meetings like this. So we're going to do a little bit of a twist on it. We've got a lot of really exciting things planned for you all.
It sounds fabulous. And of course, there was a recent publication that came out talking about POCUS. Tell us briefly about that.
So we have had basically the guidelines for regional anesthesiologists to learn POCUS, and it was such a group that came together, such a collaborative group from across the world of all of us who really love to teach POCUS, who've been publishing on POCUS for a long time, and who really want to bring POCUS to everybody. Because the thing about point of care ultrasound is it sounds really complicated when you talk about it. People say, "Oh, I can't do echo; it's very complicated," but actually, for regional anesthesiologists and anaesthetists, it is just that one step forward, especially things like lung and gastric. So what we want to do to you is bring all of that we've published in the last couple of weeks about education and make it really easy for you to integrate into your day-to-day practice.
Rosie, that sounds fabulous, and I think that should be compelling enough for anybody to come and join us for the meeting. I'm hoping you're going to spend some time on the couch with me presenting elements of the meeting. Just to finish up, 3 quick questions. So if you had a choice, what's your go-to or your favorite upper limb block or upper limb blocks?
Well, for me, it's the infraclavicular. I've always had a really soft spot for the infraclavicular, but for teaching, it has to be the axillary. And I would say that I've taught so many people axillary in the last year that people who before would have said, "Oh, I don't do blocks," and certainly don't do awake blocks. And teaching that axillary block, and that's why it is a plan A block. It's such a simple, straightforward block to do and gives great results really quickly. And it gives people confidence really quickly that regional isn't all about, "Oh, I have to know this and I have to do it this particular way," that it's a great way to improve patient outcomes.
Excellent. I totally agree with you on that. What about your favorite lower limb block?
Well, along the same lines, I am always a huge pop tail block fan. It's one of those unbelievably satisfying blocks. And once you get the ergonomics right, and, I have a particular way that I teach it, just seeing that nerve splitting and coming back together, and again, gives really great analgesia for the patient after any kind of lower limb surgery. It's just such a beautiful block. Again, super easy to teach and really satisfying for people, just getting into regional.
Brilliant. And lastly, what would be your favorite trunk block? There's a whole host to choose from. What would be your favorite?
There really is, and we've moved on from TAP to QLB to ESP and that sort of thing. And the ESP is one of those blocks I've been learning myself over the last few years, and I find it really, really satisfying. But again, for me, the rectus sheath block has really come into its own over the last while. We didn't have the staff on the wards to be managing epidurals and things like that. And those rectus sheath catheters, so easy to pop in after an emergency laparotomy, giving really good analgesia to patients. So yeah, I think after the last while, getting back to the rectus sheath, which hadn't done in a long time.
Excellent. Rosie, it was great to speak to you. I really look forward to seeing you, hopefully in person. It's going to be so much fun at REUK 21. Take care and be safe, and we will see you soon.
Okay, guys, just register today. It's going to be a fantastic meeting. There's so much for everybody, and we really look forward to seeing you there.
Thanks, Rosie. Bye.